So, to start this second anatomy lecture video, have you ever had an injury or some sort of health concern where you needed an MRI or an X-ray? And did you try to read and understand that report? The radiologist basically writes a report based on what they saw in the imaging, and to most of us, that doesn't really sound English. And that's because they use words that are based on conventions that were created so that everyone can be on the same page when they're talking about the human body. So in sports, your coach might tell you that you overextended your arm when you threw the ball. In order to understand and correct your form, you first need to understand what overextending actually means. So in this lecture, we'll learn these conventions that are used when we describe motion, and ultimately so that we as biomechanists and as kinesiologists can improve someone's physical performance, be better at preventing injuries, and then create better rehabilitation environments. So by the end of this lecture video, we will learn about these orientation and directional terms that are used as a convention to describe motion, and then we'll talk about joint movements and end with reference systems. So we use orientation and directional terms when we're trying to describe body or segment positions with respect to each other or to other objects. So the term superior is used to describe something that is above or closer to the head, whereas the term inferior is used to describe something that is below or farther away from the body. So here you can say that the upper body is superior to the lower body, or that the legs are inferior to the arms. And the term anterior or ventral is used to describe something that is towards the front of the body, whereas the term posterior is used to describe something that is towards the back of the body. The term medial means closer to the middle or towards the midline of the body. And the term lateral means away from the middle or away from the midline. So you could say that the chest is medial to the arms, or in this picture that the arms are lateral to the hips. The term proximal means closer to, whereas the term distal means away from. So here, the upper body is proximal to the head, whereas the feet down here are distal to the head. The term superficial means towards the surface of the body, whereas deep, logically, is away from the surface and inside the body. So the skin is superficial to the muscles, for example. So we saw this slide in the previous lecture video, but I just wanted to reiterate that we use these anatomical terms of motion to describe movements. So now we're going to go through a bunch of definitions that are meant to describe movements themselves. So flexion is the joint action that occurs around the transverse axis through the joints, and it causes limb movements in the sagittal planes through the largest range of motion. So in this case, this person is flexing at their shoulder. So the axis of rotation is up here, and the arm is moving upwards. In a similar way, down here, flexion is occurring about the knee joint, and the lower leg or the shank is moving towards the hips. So that's called flexion. Extension is quite literally the opposite of a flexion. So it's the joint action that occurs around the transverse axis, through the joints, always through the joints, and it causes the opposite limb movements in the sagittal plane. So it returns the limbs to anatomical position. So if the leg was previously flexed, right, at the knee, the leg was up here, then extension will bring that leg back down straight in anatomical position. Okay, so that's flexion and extension, both happening in the sagittal plane through or about the transverse axis. Next, we have abduction. So that occurs about the antero-posterior axis, and it causes limb movements in frontal planes through the largest range of motion. So in this case, abduction is about the shoulder again, but in this case, you're moving the arm outwards, away from the body. So that's abduction. The opposite of abduction is adduction. So again, occurring around or about the antero-posterior axis, and it causes limb movements in the frontal plane again and back to anatomical position. So if the arm was previously abducted out here, then an adduction movement will return that arm close to the body. Circumduction is a multiple axis joint action that occurs about the transverse and antero-posterior axes. So it's a flexion combined with an abduction, and then an adduction or an extension combined with abduction and then adduction. So the trajectory of a limb being circumducted forms this sort of cone-shaped surface. So if you abduct your arm at the shoulder joint up here, and then you move your arm and your forearm so that your hand traces the shape of a circle, then the joint action that's occurring at the shoulder joint is called a circumduction. So in a medial rotation, that's also known as an internal rotation, the joint action that occurs there is about the longitudinal axis, and it causes limb movements in the transverse plane. So in this case, the knee is turning inwards in the same way that, if your palms were in anatomical position and you turn them inwards, your palms would be turning towards your body, so doing a medial rotation. In an external rotation or a lateral rotation, then the joint action is still about the longitudinal or the vertical axis, but it causes the opposite limb movements still in the transverse plane. It just returns the limb to an anatomical position, or it turns it outwards beyond anatomical position. So in this case, the toes are pointing outwards. That would be a lateral rotation. Pronation and supination happen specifically at the radio-ulnar joint. So that's in the forearm. That's these two bones here that make up your forearm. So the radio-ulnar joint is formed between these two joints. And pronation is the joint action that occurs around the longitudinal axis, because remember, in anatomical position, your forearms and your arms are just straight down, and that's occurring around the longitudinal axis. And it's through this sort of joint down here, and it causes the palm to turn towards the body. So that's a pronation, is when you have your forearm in anatomical position with your palm facing forward, and then you turn it inwards towards your body. That's called pronation. And then supination would be the opposite limb movement. So it returns the forearm and the hand back to that anatomical position. So it turns the palms back to facing forward. And the way that I always remember what supination is if you just hold your forearms out and you pretend that you're holding a bowl of soup. So in a supination, you're holding a bowl of soup, which means that your palms are facing forward. And then pronation is the opposite. You're throwing that bowl of soup to the ground. Your palms are now facing downwards or facing towards your body. Hopefully that trick helps you as much as it helped me. Okay, so dorsiflexion and plantar flexion are joint actions that occur only at the ankle. So starting from anatomical position, remember that's always the starting point. Dorsiflexion is the joint action that occurs about the transverse axis, so it's happening through this ankle joint, and it causes the foot to move in the sagittal plane such that it's moving upwards towards the leg. So when you lift your toes off the ground and your weight is on your heels, then you're dorsiflexing at your ankles. And then plantar flexion is this joint action still occurring about that transverse axis at the ankle, but it causes the opposite movement of the foot in the sagittal plane. So your foot moves downwards away from your legs. So when you stand on your tippy toes, you're plantar flexing at your ankles. Inversion and eversion also occur at the ankle joint. These are motions that occur in the frontal plane. So these joint actions occur around this antero-posterior axis through the foot, and an inversion occurs when that medial side of the foot or of the sole is lifted. So it's like you're standing on the outside of your foot. And then the return to anatomical position and the movement of the foot beyond that anatomical position, where the lateral side of the sole is now lifted, that's an eversion. So if you've ever rolled your ankle, you're probably familiar with these terms. Okay, so this next set of movements is only possible for very few places in the body. The scapula, as is shown here, so those are your shoulder blades, and the mandible, which is your jaw. So elevation is the superior movement of a limb in the frontal plane. So you're bringing your shoulder blades upwards towards your ears. And then depression would be the inferior movement in the frontal plane still. So you're either bringing them back down to anatomical position, or if you can, further down. Protraction and retraction, so these two movements here and here, those are movements in the sagittal plane. So protraction, which is also called abduction, would occur when the scapula moves forward. So when you're bringing your shoulders forward, whereas retraction or adduction occurs when the scapula moves backwards. And then finally, the scapula has moves in an upward and downward rotation as well. So those are both occurring in the frontal plane, same as elevation and depression. But in this case, you're really like rotating them. Rather than just bringing your shoulders up, you're moving the whole scapula, your arms included, upwards and downwards. And I think this is the last joint movement that we need to cover. It is called opposition. So it's the thumb movement, again, very specific. It brings the tip of the thumb in contact with the tip of a finger. So this movement is produced by a combination of flexion and abduction of the thumb. Okay, so let's put everything together now. We know the terminology regarding these body motions, and we know that the motions happen in planes and about axes, right? We learned that in the first video. So when you're trying to determine which planes or axes are involved in a motion, you can picture a bicycle wheel, like in this picture here. So the plane is the wheel itself, and then your body and the moving parts of your body are these spokes on the wheel. So imagine the arm in this case is just these different spokes on the wheel. And then the wheel turns about an axle, much like your body moves about an axis. So the axis is the axle of the wheel, and then the plane is just the wheel and the spokes. So you can remember this visual, and if you have a bike wheel, put it against your body, and when you're moving, you'll see that your body is always moving with the wheel itself, and then the axle of the wheel acts as the axis of rotation of your body. So the next few slides are just recapping the many, many definitions that I just gave you. So this is a summary of the joint actions that occur about the transverse axis. So you have flexion and extension, dorsiflexion, remember, and plantar flexion are specific to the ankle joint, but those are the movements or the motions that occur in the transverse axis. Now in the antero-posterior axis, you'll see things like abduction and adduction, lateral and medial flexion, and then about the longitudinal axis, that's the rotation, right? The twisting. So you'll have external and internal rotations. If you can somehow rotate your entire head, then that would be about the longitudinal axis. So we just have one more quick thing to cover in today's lecture. The planes and the axes are used as reference systems along the body to describe motion. But they also move along the body, right? So it's also useful to make use of a fixed reference system, mainly just to standardize the measurements that are taken of the movements, and just as equally to describe a movement in space rather than just in regards to the body itself. And this is called a spatial reference system. And the system that's most commonly used in biomechanics is a Cartesian coordinate system. So in a Cartesian coordinate system, the units are measured in the directions of either 2 or 3 primary axes. So you would have either a 2-dimensional or a 3-dimensional movement. And movements that are primarily in a single direction, such as running or cycling or jumping, those can be analyzed using a 2-dimensional Cartesian coordinate system, like the one that's shown here. So in a 2D coordinate system, points of interest are measured in units in the x-axis, so the horizontal axis, and the vertical axis, or the y-axis. And when we analyze the motion of the human body, the points of interest are usually the body's joints, so the elbow, the knee, the ankle. The location of each joint center can be measured with respect to these two axes and described as x, y coordinates, where x is the number of horizontal units away from the origin being at 0, 0 here, and then y is the number of vertical units away from the origin. So when a movement is 3-dimensional, then the analysis can be extended to the 3rd dimension by adding a z-axis that's perpendicular to the x and the y-axis. So that is, a rough sort of explanation of what this Cartesian coordinate system is. So here we have a 2D Cartesian coordinate system, right? We have the x-axis along the horizontal and the y-axis along the vertical. So the first thing that you need to know is that the arrows are pointing in the positive direction. So we have our origin at 0, 0, and as we move further away from the origin, our units increase in the x and the y directions. So can you pause the video if you need to and guess what the XY coordinates are for this person's hip joint? So what are the coordinates? If you were writing a test and it just said, what are the coordinates for the hip joint? What would your answer be? So the figure's hip location is 10 units horizontally, right? 10 units here, and 15 units vertically. And that's what the coordinates are for the hip location, 10, 15. Okay, what about now? What are the hip coordinates now? Hopefully you got it right. 30, 10. So 30 units in the x direction and 10 units in the y direction. Okay, that was a lot of definitions. I don't blame you if you had to pause and re-listen to this video 10 different times, but it is very important, and it's something that you'll use, it's terminology that you'll use for the rest of your undergraduate career for sure, and then who knows what sort of career you'll have after that where these terms are constantly being used. So just to recap what we learned in this lecture video, we learned about all the orientation and directional terms that are used to describe motion. We learned about the joint movements themselves, and we finished off by just getting an understanding of what reference system, what it is, and how we use it in biomechanics to just locate different joints on the body.